Wonderful. Welcome everyone to Being PreHealth at Duke. I'm Brittany Moorhack. I'm the Associate Director of Health Professions Advising here at Duke. We're joined tonight by our director, Dean Melissa Purrs, who will talk for the second half. We're just going to spend some time today giving you an overview of our office and how we work together with PreHealth students. So our mission in HPA is to partner with our undergraduate students and alumni for 5 years post-graduation. If you're pursuing Pratt or Trinity degrees, we work with everyone. And we work with students who are pursuing a variety of different healthcare careers. What's really important to us mostly is to power each advisee to be themselves, both as a person and as a future healthcare professional. So we want to think about each of you as individual people on individual paths with different goals and coming from different backgrounds, and help you create a plan that's tailored to your personal unique self. We like to start with the data because it's often the thing we get the most questions about, but it really and truly is just a starting point. So the majority of our students at Duke who are pre-health are pre-med. And so you're looking at some information about our first year med students who are across the country doing lots of different things. So we have 265 people who applied to medical school who are currently first years. 80% of them were accepted. And our median MCAT for those students was a 518, but we have a really wide range of students who are successful. So our MCATs ranged from 500 to 528 for our students who are accepted and our current first year students. Our BCPM and our cumulative GPA looked like a 3.83 and a 3.88 as our mean, but our range was incredibly wide. So you'll see we had students admitted with as low GPAs at 2.90 and all the way high to a 4.0. The little asterisk does indicate that the students on certain ranges might have done additional work after graduating from Duke. But I think what we really love to highlight here is that there is no perfect number or metric or thing that you have to do necessarily to get into medical school. We work with everyone, regardless of your GPA and your metrics. We want to help you find the right medical school for you if that's the path you're on. So what do our timelines look like? This is a really common question as students are starting to think about their 4 years in college. For us at Duke, 11% of our students did direct matriculation. That is very much on par with what we see from peers. It's also on par with what we hear from highly selective medical schools, where most of their class is made up from students who are taking gap years. Our students who take one gap year, which is applying at the end of their senior year, there's about 39% of our applicants. But half of our applicants in contemporary times are taking 2 or more gap years. This just allows for flexibility during your time at Duke, whether that's studying abroad or engaging in all of the things that are unique to Duke, gives you a little bit more time to explore and to build your portfolio in a way that you feel comfortable. So where do our Duke students go? This is one of my favorite slides to update every year because it changes a lot. You'll see some common names that stay year to year. These are the schools that you're seeing on the slide that have 3 or more Duke students who are first year students there. But these schools change. While we do have some that stay year to year for long periods of time, it can change based on interest of our applicants, what states they are coming from for home. I think what we're most proud of is that while you're seeing a variety of schools on this slide, there are 63 more institutions that are represented where our students are first year med students. We are really proud of the fact that our students are accepted to a wide variety of schools and choose to matriculate to more than 90 schools every year. So who's helping you all along the way? There are 5 of us that are full-time pre-health advisors. This is what we do every day, is work with students in crafting their academic plans and experiential plans. In addition to myself and Dean Purrs, we have 3 wonderful assistant directors and our staff assistant, Ms. Westray, who keeps everything running in our office and sends out a weekly newsletter as well. We advise on a vast array of different professions. I know I spoke earlier that most of our students pursue medicine, but we also support students who are pursuing careers in dentistry, veterinarian medicine, physical therapy, genetic counseling, physician assistant, nursing, optometry, occupational therapy, and more. We really want to help students find the path that's right for them. We do have several career paths that are indicated with the asterisk here today that also have student organizations. So any student who is pre-health would be assigned someone to work with in our office, but there are also additional advisors and resources and organizations on campus that can help you find community as you're preparing on this track.
All right. Thanks for getting us started, Ms. Moorhack. I'm going to talk a little bit about how advising works, and this will change across time and with advisees' needs. In the first year, we really focus on students having a good arrival, getting situated as Duke students, and building a community. That community is of peers. It'll happen through organizations and interests, but also can happen in academic and other spaces with faculty where you'll build relationships and hopefully receive mentoring and get started on things that will lead to letters of recommendation down the line. As we welcome students to the Duke campus, we'll begin in summer prior to registering for classes with a webinar that will make sure that you know what the pre-health classes are that first years are often taking. We have lots of different placement levels, and so we'll talk about how to use those AP scores and other pre-matriculation tests and credits to figure out where the best place for you to start in those series and sequences will be. We'll also, touch on fitting these things in around major interests and Pratt and Trinity curricula. You'll get to meet your pre-health advisor that's been assigned to you at the end of orientation week at our welcome event. And then we'll kick off after that curriculum that's designed for students who are in the preparing phase of things. And I'll talk a little bit more about that in a minute. Whether you are exploring a range of health careers or have chosen a profession or are ready to prepare, our office is going to help you engage in both professional and personal experiences where you'll build self-awareness, but also understand the profession that you're getting into so that when you apply, you're ready to write how you're ready for that profession. We'll add on to that group advising that we do through workshops in our preparing curriculum to more individualized one-on-one kind of encounters through a combination of group advising as well as individual appointments. Our philosophy through our curriculum is to talk to groups about the stuff everybody needs and then narrow down to the more individualized kinds of questions that you have through advising. So we really expect engagement in that curriculum so that we can be efficient in the advising. The other thing we're really proud of is we teach our students how to self-assess. None of us sits on an admissions committee, so we can't tell you, yes, so you've got our blessing. No, you don't. It doesn't really matter what we think, but we do talk to admissions, deans, and directors. We look at our data and really try to figure out what are the trends so that we can advise our students the best. So along the way, we'll not only have you craft plans for coursework for pre-health, figuring out when you take standardized tests, but we'll also make sure you're educated about the experiences. Along the way, though, we want you to go through that cycle of plan, do, and reflect, and then make more plans that are in response to those. Because I am willing to bet you'll all try something out you thought you'd like that you won't like, but you'll also try something that's going to surprise you and want to gravitate toward that more. So listening to that small voice inside of you about where to go is going to be one of the best things you can do. But we're also going to do that self-assessment or teach you to self-assess so that you can make the decision about when you're ready to apply and going to be competitive. We're proudest of probably the resources we put into our applicants. And we really think this makes a difference in the outcomes we see. I don't think Ms. Moorhack mentioned our acceptance rate for medical school usually is around twice the national average. So we have got great students, but we also get great outcomes as a result of it. So when you get to the apply stage, we're going to help you finalize your candidacy, prepare a strong and authentic narrative application, and then just support you through the long and stressful cycle. We've got a whole separate application curriculum and what I call the crown jewel of pre-health advising at Duke. Everybody, if they're on time, can schedule a review my application appointment where you'll write a draft. We'll give you feedback on it. We'll help you think about the schools where you're going to apply, who to get your letters of recommendation, so you can go forth with a great deal of confidence. These are the kinds of services that other institutions don't all provide. And if you want them, you often have to pay expensive counselors. But we provide them for free to Duke undergrads. And I'll just remind you, we'll continue to serve you for up to 5 years post-graduation. So I think these are things that really make a difference for our applicants. We'll also provide mock interviews so that students are ready for those verbal parts of the application after they've gotten feedback on their writing. All right, so we really spent a lot of our time on the preparation phase. Courses are an obvious component. Not only do we want to make sure that you know what the courses are that will help you prepare for your profession, but also think about how do they get timed with respect to standardized tests, but also fit into things like your curricula as well as your major and things like that. Experiences are also important. It's very critical you not treat either of these things like a checklist, however, because the AAMC has defined the competencies that they hope that applicants will develop. Could I have it advance? There we go. So the combination of the courses and the experiences will hopefully develop the competencies. There's a wide range of ways for you to engage with these things. And again, that authentic exploration and individualization is so important to your competitiveness as an applicant. It's really easy to think about these things through the lens of requirements, but one of the things we do with advising is to really highlight where you have choices and making those choices so that not only do you flourish at Duke, but you're an interesting and well-prepared applicant. If you only think of things as onerous and requirements to check off, you're going to miss out on some of the best parts of your undergraduate education. So we're going to support that flip and looking at it through the lens of choices. I could have the next slide, please. So the experiences that most health professions advising offices will look like this somewhat. But what I want to highlight in the next couple of slides is where we think Duke really makes a difference. So under academics, can I have the next slide, please? Under academics, we have lots of opportunities for you to get started, build strong relationships with peers and faculty through the first year experience in Trinity and in things like the first year design course and other opportunities in Pratt. We have a huge range of undergraduate majors that you can choose from, including a self-designed major we call Program 2 and an interdisciplinary or interdepartmental major that if you are interested in two departments but don't want to take all the courses that a double major would require, you can create a blended plan through the IDM. We also have minors, including some that we don't have a matching major for, so it extends the academic possibilities. We have interdisciplinary certificates that are combinations of courses or courses and experiences. Our students can write an undergraduate thesis and graduate with distinction. We have a fabulous global education office and high level of engagement in study abroad, including for our pre-health students, which isn't always really easy to do. And then supporting the rigor and all the wonderful things we have in academics. We have an academic resource center where you can book an appointment with a learning consultant to talk about help in classes, test anxiety for standardized tests like the MCAT, or participate in peer-facilitated learning activities. Under patient engagement, we definitely benefit from being a campus that is connected directly to our health system. So we are not separated from Duke Med and all the professional schools. Our building is right next to our medical campus. So our students are able to volunteer in assisted living facilities, Duke Hospital. We have great student organizations. I like to highlight two really fabulous ones that show up in applications like Duke Help Desk and Adopt a Grandparent. Our students will get certifications like nurse aide or EMT and work out in the community, getting hands-on experience. We have a lot of students that will do clinical research, and we have one of 5 campuses funded by the Coleman Family Ventures to provide funding for students interested in family medicine and pediatrics careers. We also have lots of ways for students to develop career knowledge. Probably the biggest, most obvious one is our shadowing program. We clear our students to shadow in our health system, have a database of students who are providers who will let our students shadow, so we make it relatively easy to do that. Got some really cool programs like Reimagine Medicine and the Marine Scholars in Medicine program that are various types of activities that build that knowledge. Our Career Center is fabulous for helping students find internships and gap year jobs and think about just who they want to be when they grow up from a career lens. And then we have a opportunity to take undergraduate classes that will count toward a master in nursing through the Duke University School of Nursing Bridge program. May I have the next slide? All right, we're also a campus committed to service. So that shows up in our strategic mission of knowledge and service to society. We've got many student organizations that partner in the community. We've got courses that put you out in the community doing service as part of your learning. Duke Engage is a funded experiential summer program that's all about civic engagement. And then we have strong partnerships with other community service organizations through the Durban and Community Affairs Office. They run a volunteer fair that will promote out in the fall so students get started in campus and town. We are a Research One institution, which means research is abundant. You can apply for research programs through our Muser. We've got funding through VIP and the TriPath programs. Bass Connections is a team-based research project that's really accessible, especially to our first years wanting to get started in research. And then we have a really unique opportunity for students to do research through classes and independent projects out at our Lemur Center. So, and this just probably is the tip of the iceberg in terms of our research opportunities. And then finally, just through hundreds of student organizations, lots of ways of engaging. Our students can engage in teamwork and leadership. So I think the combination of being a highly selective school with rigorous academics, adjacent to a health system, and just a highly engaged campus, we offer our students a wonderful buffet of opportunities. I think one of the things we provide as an office is just helping students pick and choose from the wealth of opportunities. But there's lots of ways to be highly prepared, involved on our campus, and be a really terrific applicant by the end of your 4 years. And the next slide. Okay, so before we start tackling questions, just want to let those of you who were early decision or have decided to commit to Duke, or when you decide to commit to Duke, what comes next. So you can register with our office. This will put you on our mailing lists. We'll keep you informed about our upcoming activities. So if you're ready to do that, the QR code is here. If you decide later on to commit to Duke, this will be available under the advising tab of our website. So no rush to do this today. It's not going away for you. As I mentioned, we'll meet up again in summer to talk about registration advising through our summer transition series webinar. That'll be on July 4th from 4 to 5 p.m. That will be recorded. We will post the link. Student Affairs, Student and Family Program will post the link. So you'll be able to access it if that's not a convenient time for you. And then you'll get to meet your pre-health advisor at a welcome event on August 21st. We'll run 2 start times on that day. You don't need to come to both, just come to one, hear our spiel, meet your advisor, get all the questions you need to get answered before classes start the following Monday. And then we'll continue to work with you on our preparing curriculum through the fall. So that's kind of a snapshot of who we are and what we do. And we will start to take questions now.
So yeah, we've had a couple questions come in already, a couple that I answered based on my experiences, because I actually am still a senior here, even though I am not currently involved in pre-health advising. But one of the questions that was first to come in was specifically thinking about BME. They were wondering if how you can get courses that both fulfill major requirements as well as med school requirements. They were specifically talking about BME, but I think that this is kind of relative to any of our other programs as well that we have here, Chem, Bio. So would you guys talk a little bit about making sure first years get courses to fulfill both of those requirements?
Brittany, do you want to start?
Sure. We'll start with BME since that's where the question was rooted. Our BME curriculum aligns really nicely with pre-health requirements. And so most of the courses are already in line. I think where our engineering students pay the most attention to adding courses would be things like social sciences, specifically sociology and psychology. These are courses that are tested on the MCAT. And so those are aren't as evenly baked in to the curriculum for Pratt, but most of the other pre-health requirements are. The other place I think that our BME students pay a little bit more attention to adding coursework in is organic chemistry. A lot of our students will plan that out a little bit differently if they're in Pratt. For our Trinity curriculum, I think that it aligns so beautifully with being pre-health. One of the things you hear our office talk a lot about is you should major in what you're interested in. Medical schools, other health profession programs are really interested in interesting people, people who follow their curiosity and let that kind of guide their decision making. And there is no one major that you have to major in to be pre-health. And our curriculum is a way that you are going your curricular choices and the pre-health pieces together, and they overlap in some ways really nicely. So while you're pursuing both parts, you feel like you're making progress at the same time. I like to point out to first year students, just by doing your first year courses, you are often doing anywhere from 3 to 4 courses that are pre-health related without even trying. It's just part of the first year experience here.
Alyssa, do you have an answer to that as well, or next question?
Let's just do the next question. Thanks.
Cool. So this one was a little more pointed as well, and it was actually talking about international students. And it's Duke send international students to med schools in the US, specifically talking about an F1 visa. And they were kind of asking about if you guys had ratios or how their preparation may differ in sense of like mentoring and experiences.
Yeah, I think it's been a while since we've looked at the acceptance rate for our students on visas. As implied by this question, it is much harder to get into medical school in the US if you're here on a visa. While our undergraduate institutions welcome students internationally with open arms, medical schools are really more focused on building up a healthcare workforce for the country. And so there's just fewer slots. A lot of our state schools won't accept international applicants. But in spite of that sort of grim news, I think last time we looked, 75% of our students on visas who applied got accepted. So that's only a little bit lower than that overall acceptance rate that stays pretty steady. We do advise our international applicants on what are the schools that are friendly to students on visas. Students on visas will often feel more pressure than the rest of our students to avoid a gap year so that they don't have to worry about getting a work visa or getting a visa to come back to the country to interview and things like that. So sometimes the preparation timeline is a little bit different, but we're also, we have Duke NUS in Singapore. That's a great choice for our students coming from Asia, for instance, that have a strong research bent. So we will help students, like all of our applicants, craft a list of schools and do that with the schools that are open to international applicants. And then also think about those global schools. There's schools in Queensland, Australia, and some in the UK that offer a graduate type of education. And so we just sort of help our students think about both US as well as other options to assure a high success rate.
Cool. That's a really good answer, I would say. A next question that we have, one of the primary reasons the student is really inclined towards Duke is the presence of their on-campus hospital and the abundance of research opportunities. They're wondering about taking advantage of this and gaining hours in research and shadowing in your first year of undergraduate, and if you would have to then compete against upperclassmen that are also looking to volunteer at that same time.
I think as Dean, our hope for you in your first year is that you're focusing on transitioning to Duke. And so for that first semester, just kind of getting your feet underneath you. We do have first year students who are involved in things like research and are shadowing. We encourage students to shadow a little bit later into their first year. That's not something that's open right away. Our shadowing program syncs up with the flu vaccine availability, so it has a slightly different timeline than some of the other opportunities. In terms of volunteering at the hospital itself, the hospital runs the volunteering program, not us, and they do pretty early application season into volunteering. And so that is something that first year students are usually looking at a little bit later, looking at second semester or beyond. And while that is a program that does have a limited amount of seats, I think students feel like there are a lot of options for getting involved with patients and research. And that just looks a little bit different based on people's interests and backgrounds. So usually first years are going to start with something like community service. Maybe they're adding a little bit of research in, but trying not to add all the things at once, especially in that first semester.
Cool. Yeah, the transition to Duke is difficult for a lot of people, and there are a lot of things going on. So I do just want to say, within personal experience, if you're worried about being behind as a pre-med student already, you're not. You haven't even got to your undergrad yet. You have a whole 4 years. And I say that specifically because of this next question, where somebody was like, I want to avoid the gap year. How can Duke support me trying to directly matriculate? And if so, what is the timeline that I would have to take?
Yeah, that's a great question. And we would estimate that 80% of our students come in wanting to avoid a gap year, and then about 80% come out the other end taking a gap year. So we see it very much as an advising tool that we use if someone wants to study abroad and is trying to decide between avoiding a gap year and having this great undergraduate experience. But to avoid a gap year, it's possible. Some of our most competitive applicants will do that. Some things that will help are if you come in with advanced placement, international baccalaureate, or other kinds of test or pre-matriculation credits in STEM, particularly calculus, chemistry, physics. Those can be really helpful, although not necessary. To avoid a gap year, you need to have all of your classes finished and your MCAT or standardized test completed. The latest we would recommend would be April of your junior year. So that also gives you about 3 years to gain all the experiences and all those categories that we mentioned in the slides. So it's possible, but it does require coming in, taking classes, gaining experiences from the get-go, and just really being on track. I tell my advisees, I will support you if that is your plan. And, but we need to be in good communication about what that looks like and be efficient about it. I would say we wind up with so many students taking a gap year because it winds up becoming a really pragmatic choice. They and the other thing the way I would frame gap years is they only make you more competitive. So sometimes we'll have a pretty good applicant who's not kind of fully baked and having another year to spend that junior to senior summer doing the MCAT instead of racing to get it done during the school year, or allowing us to decouple preparing for the MCAT and writing the application. It just becomes a choice that lowers stress and will increase opportunities and options at application time. Most admissions committees are not going to have the pile for juniors and the pile for the more prepared students and give you special consideration. You all go in one pile. And so one of the disadvantages a junior can be is you haven't written that thesis. You just have had less time to get a publication. You haven't had as much time to reflect. So those are all the reasons why I think we have such a huge number of students taking gap years, but we'll underscore for a student who's really determined, we'll work with you and we'll show you the path. We're not going to hide it from you and force you to take a gap year. So that's kind of the philosophy we work with.
Yeah, and I'll honestly echo that as well because I mentioned that I'm a student. I'm a senior right now. A lot of my friends are graduating, my pre-med friends. Some of them are matriculating straight away to med school, but some of them are, I want to continue this research I was doing for another year. Or some of them want to go do a Fulbright abroad, or some of them want to go do like just things that they wouldn't have the opportunity to in med school because it is such a large time commitment. And I kind of say that as well because not all medical school pathways are the same. A student was curious how your guys' advising office would help students discover different medical pathways, maybe not just a regular MD, and maybe like trying to discern if you want to do pediatrics versus something else, and how you guys go about that.
Yeah. So I hear maybe two different questions in there that I want to attend to. So we do have students who pursue lots of different dual programs or have interests within medicine. So whether that's an MD PhD or an MD MBA or an MD MPH, lots of the letters and the acronyms all put together. We have students who are exploring those interests. I would say, or those often come up organically. A student comes into an advising session and is like, I am loving my research and I want to do more of it and I want my career to have more of it. Or I just took a global health class and I think I want some public health infused into my education. And then we're kind of talking through school selection at the end where we kind of know you really well and what your goals are of finding the institutions that do those programs or offer those opportunities in a way that feels authentic and organic to what you're looking to do. That really comes from classes and experiences, what you're having in the classroom, what you're having in the research spaces, in your volunteering, what are creating questions for you, what are you saying I really like to do? And then sometimes it is one of us going, have you considered doing a dual program? Have you looked into that option and what that might look like? We also encourage our students along the way to be looking at medical school programs and what those programs offer. And sometimes it'll pop up that way for a student too. I was looking at my home institution, my state school, and they have this really cool program that I didn't know existed in medicine. And now I want to look for more that look like that. And we can kind of help think that through together. We also have a lot of schools that do webinars that we'll advertise through our office. And we have health professions fair where schools are coming and kind of talk to them about their different programs. In terms of specialties, I love to point out that the AAMC recently posted some research where 80% of their medical students matched in a specialty that was different than what they thought they would coming in as a first year med student. So we want you exploring at an undergraduate level to understand, do you want to be a doctor? Do you want to be a nurse? Do you want to be a PA? Like, what does that career path look for you? But medical schools, particularly, don't feel like you need to know what your specialty is going to be. We have lots of opportunities through volunteering and through shadowing to have exposure to lots of different departments and types of medicine and different roles. But if you're going the medical school route, they're going to then give you 4 years in medical school to continue to deepen and explore the specialties and figure out what exactly that looks like for you. You absolutely do not need to know what specialty you want hitting submit to med school. I have some students who have a general idea. I have some students who think they know what they want to do. I have some students who have no idea. They're really sure about the physician piece. So again, it kind of based on those experiences. When Dean Pers was talking earlier about planning, reflection, assessing, and then kind of changing your plan based off of that, our hope for you is that you're having experiences at Duke that are blowing your mind in good ways, that are exposing you to things you've never seen before or heard before. And that's kind of guiding what that next step looks like.
Yeah, that is also a really good way to say as well. Because looking up through a couple of these questions, there's a lot that are things towards the later part, especially that I've answered. Because somebody was asking about like upperclassmen mentors, and they were talking, how can I start talking to like juniors and seniors that are maybe pursuing these medical degrees? I mentioned Blue Devil Buddies and like their experiential orientation programs to start to get to know upperclassmen. Do you guys have other programs or things that you would recommend for first years to get to know upperclassmen that are going through this process now?
Yeah, one of the things we just did some strategic planning as a team, and we really want to step up in the next year, developing a cadre of sort of peer advisors. A number of the programs in our curriculum, we've brought in upper class students. So when we do 4 year planning, for instance, we have them talk about, classes they've taken and how they navigated major and some of the other choices that come with making a 4 year course plan. I think we've had panels in the past about how students have gotten clinical experience. Kind of piggybacking on the last question about exploration, we did a cool program this spring where we brought in the representatives from our health professions schools interprofessional education committee. So we had graduate and professional students come in and talk about what next steps look like. So students could get to meet graduate and professional students in some of the pathways and learn about those pathways at Duke and just generally how they did it. So there's also lots of health professions related student organizations. Ms. Marhack and I both serve as the faculty staff advisors for a couple of them, and there's still more. So those are other opportunities. We're especially excited. We have a new student club called the PreHealth Coalition. That's for all the non-pre-medical students because sometimes they feel like nobody talks about them and really want to increase visibility and support. So that's just another place where students can talk to upperclassmen that may not be pre-med but are interested in health professions.
Yeah, and that honestly kind of leads in great to the next question because somebody was curious about CNA courses offered or specifically nursing adjacent programs, if Duke has any CNA opportunities or if there's neighboring institutions that they can do while they are a Duke student.
Do you want me to talk about that one, Brittany?
Yeah, I figured you might want to.
Yeah, so one of the parts of the funding from the Coleman Family Ventures we're using is to support paying for a CNA class through our Durham Tech Community College. So we've got, I think, 12 students this summer that will be enrolling in a free to them class at Durham Tech to get certification. And then what we're trying to do is build out support for students then to get jobs during the school year to work in float pools in hospitals or pick up shifts at assisted living so they can make use of that. We will share, I think we're all a little less enthusiastic about becoming emergency medical technicians certified. Not that it's not a great experience, it's that our Duke EMS squad has really been limited in what they can do, and they have 7 slots total. So across 4 years, very limited opportunity, and they mostly do event kind of support rather than running 911 call out in the community. Our other students who are EMS certified tend to have to go a county or two over to work, which just adds to commute times. So there's a lot more opportunity to work as a certified nurse aide. I'm not sure if Ms. Moorhack would agree with me, but I think the certified nurse aides show up a whole lot better in their application than the EMTs do as well. I find the EMTs have blind spots about what does healthcare look like outside of pre-hospital care. And so recommend that route over EMS.
Yeah, I also know a couple of people on the EMS squad, and I didn't realize how limited it was, honestly. But yeah, that's honestly interesting to know. This student is thinking about another thing that will be quite a ways in the future, and they were asking about institutional letter packets and if there was preparation that they needed to take in order to be better prepared to ask for those, I guess. They kind of just said, what should we know about institutional letter packets?
I'd love to give a virtual high five to whoever's clearly been to our website who knows it's called an institutional letter packet. So kudos. So the institutional letter packet process is designed hopefully to help you with your application preparation. So when we were talking earlier about RMA, review my application appointments, where we give you feedback on your application, part of that is a collection of essays that we are using for a couple of different purposes. And one of them is we do that in the spring. We give you the essays in the fall so that you have lots of time to work on them. And then students who get an RMA appointment and schedule one get feedback on those before they submit what we call best and final to us. That deadline for your friends who are applying to med school is coming quickly, Connor, on May 1st. So you get us best and final essays in the spring, and that's what helps us finalize the institutional letter, which is part of the packet. And then we currently use a third-party cloud-based software or cloud-based system called Private Folio, where your letters go up and then we just package them together once you're verified. We try to make things pretty streamlined where we can. You submit things through our Qualtrics links, so it's easy for us to get the information quickly and put it together for you. We put together a very detailed guide every spring, so we walk people through the steps for getting all of the packet materials to us so that it's not something you have to stress about. And then we're available as a team pretty regularly in May and early June for those questions. We really try to stress that the packet is meant to enhance your application. We really want to help highlight your intellectual and academic interests while you were at Duke and just make sure that we're singing in harmony with the things that are important to you from an academic perspective.
And I'll just add, in case you're looking at schools that offer committee letters, we replaced our committee letters with this institutional letter packet in the pandemic when things went sideways and students couldn't shadow or volunteer with patients. And we had no idea what schools were going to do with those changes. We felt really uncomfortable providing an evaluative committee letter. So we just stopped doing it. And we've never gone back. And we were convinced by peer institutions like Yale and BU and probably others I'm not thinking of that saw zero difference in their acceptance rate. We've seen zero difference in our acceptance rate moving to this institutional letter packet. And what it's allowed us to do is put our resources into that review my application advising. our internal data says that advising has a greater impact on acceptance rates than committee letters ever did. And so we're really excited to be able to offer that great resource without compromising our acceptance rates.
Cool. Yeah, I honestly didn't know about institutional letter packets. I saw that this question was here, and so I researched it up to make sure I wasn't asking something that I shouldn't be asking. But it's interesting to know that Duke changed that and other institutions have as well recently. Kind of now thinking on the opposite side, the student is asking about like AP/college coursework that they would recommend to pre-med students. They're specifically thinking because of Trinity, because the Trinity college only lets you use 2 credits to count towards graduation. So are there classes that they can use for that graduation requirement and like a pre-med requirement?
Yeah, so I'll take this because I'm an academic dean and answer this question all the time. So while you can only count 2 APs toward the 34 credits to graduate, you can count an unlimited number of AP and pre-matriculation credits to place into higher level classes, use them to meet co-recs for majors. Sometimes majors will have limits on the number of classes you can count toward the major itself, but those co-requisite classes, they tend to not be limited. So 2 is not quite the end of the story. At this point, we tend not to encourage students to take a lot of extra college level coursework, or I don't, go take your AP exams if you're prepared for them and can do well on them, because you can place out of some of the introductory level classes. And one of my goals that we haven't stated here as a pre-health advisor is to free up as many electives to get to take classes that you want to take rather than somebody else's idea. So sometimes placing out of those classes. There's also a pretty good acceptance at the professional schools of those AP credits. It does vary a little bit. I always like to point out, for example, UConn doesn't take AP credits. So sometimes, one of the things we're going to do really early on is have you researching school requirements and those policies that are particular to individual schools. But for most people, getting those AP scores in the STEM classes will help you to take more advanced courses. And we will, through advising, if you discover later on, oh, I really need a college class, this school that's important to me won't take my APs. We've got some tricks up our sleeves that we can use through advising later on to help you navigate that. But we feel pretty confident in saying, use your AP credits to take more advanced courses if you scored where Duke will put you into a higher level class.
Yeah, which does happen for a lot of those classes. I know specifically for AP Chem, we actually have an advanced Chem 110, which is kind of an accelerated Chem 101, and then our second general chemistry class, which is Chem 210, kind of combined all into one. This student is asking, in the medical school application process, is there a perceived difference between research experience earned through extracurricular opportunities versus independent research courses?
Good question. We don't see a perceived difference in how schools view that. Where schools put the most value in, honestly, whether it's research or anything you're going to do, is how you're showing them that you've learned and grown in experiences. So medical schools, other health professions programs understand that sometimes you volunteer for research, sometimes you're doing it for credit, sometimes it's a paid job. They are less concerned about the label that goes on it and much more concerned about how much you're driving the research, how engaged you are with the research. So if 2 students both have independent studies, but one student is doing a lot more of the driving of it all, they're creating the hypotheses, they're creating protocol, they're doing data analysis, they're creating things that go outward, publications, posters, that quality of engagement for them is going to be much higher than somebody who is following somebody else's protocol or collecting data off of somebody else's plan. So they really look more at the quality and to what degree you're doing the driving of the research and less about whether someone's giving you credit or not. Now, when we talked earlier about integration of pre-med, prereqs, and Trinity requirements or Pratt requirements, there might be really good reasons to get independent study towards your major or towards credits towards graduation that are a little bit different. But from a medical school perspective, they're much more interested in what the actual experience is for you.
That's interesting to know. Someone was also asking, like, sorry, I'm just reading a couple questions. Back to Alyssa's point about more advanced classes, they asked, is there anything like, is it okay to sometimes retake a class, especially something like chemistry, so they're not jumping straight into college level orgo. Is that something that Duke students do at all?
Yeah, the chemistry department will put limits on how far away you can be from their recommended placement. So if you place into organic chemistry, they will not allow you to take Chem 101 or Chem 99. They'll allow you to take organic or that chemistry 110 class. And they've got all this on their website, and we would recommend that anybody who's got something that would put them in a higher level class talk to the director of undergraduate studies in that department. These courses, these departments like chemistry and math that have placement by AP, they will have a chart that suggests where to go, offer advising contacts as you're getting ready to register for classes to help you make the best decision. We used to offer a first year only section of organic chemistry. We don't do that anymore because it was too constraining, but we used to do it. And we would always tell incoming students, we do this so you don't have to take a class with all these upperclassmen. But the reality was, it was always those first years with the 5 on the AP exam that were busting the curve for everybody else. And so having that kind of protected the upperclassmen from those chemistry whizzes with AP 5s. But all of our placement advice is based in data. So while you may feel hesitant about starting in organic chemistry, the chemistry department has a great deal of confidence that you're ready for that and you're going to be successful based on the data analysis. It may feel like, oh, if I go do something that's more familiar and I take that easier class, may feel like the safer bet. I withdraw a lot of people from those classes because they don't put the amount of effort they need into it. Your Duke professors are going to write harder tests than your high school teachers did, whether you've seen it before or it's new and you're challenging yourself. So, complacency can be a real challenge if you take a class where you're kind of bored most of the time because you think you've seen it before, but then you get a whopper of a test and you have not been engaged sufficiently in the same way you would be if you were pushing yourself into organic chemistry. So just kind of keep that in mind. This is a great space that if you have opportunities to talk to our peer success leaders or other students that have taken this class, these classes, I think you can get some confidence that the placement advice is not pulled out of thin air, but it's grounded in data.
Yeah, we did have another question come in while you were answering that about maintaining a 4.0 GPA while taking the most rigorous classes. Is that possible to be balanced?
Like to talk about possibility and probability in my office a lot. I want to start, I think, more than anything, answering that question like, you don't need a 4.0 to go to medical school. I don't know how many times I can repeat it, but like, you don't need a 4.0 to go to medical school. We do understand and definitely advise students you want a strong academic foundation. That part is important, and we wouldn't want to tell you otherwise, but we don't want people to feel like the only way to get into medical school is a 4.0. We know that's not true. We see a really wide range of GPAs be accepted, and so there is a balance between putting yourself into a course load where you can be successful, but success isn't just the letter grade. It's challenging yourself in a place where you feel like you're learning new things and you also have a full balance. We want you to still feel like you have time for experiences. We talk a lot. There are sometimes students who are metrically really strong who don't have the same experiences ready when they go to apply, and they just don't do great in the cycle. And so making sure that we have both of those things are important. Team P is pulling up our numbers as a reminder that we send lots of people to med school with lots of different numbers. I think that range is something we put up very because we want people to see there are a lot of different pathways and a lot of different numbers that you can have to be successful. We don't want you to feel that pressure for a 4.0.
Cool. With that being said, I think we can do one more question. There's not too many open, but this student is asking about what would you recommend to do in the summer over before your freshman year? Because they're worried about not jumping into research right away compared to others. And I don't know if you guys have any advice to these potential first year students here at Duke about what they should be doing this summer.
Yeah. enjoy it for your last summer before you start here. Once you get here, the summers go fast. That long list of things that we talked about in the Duke difference, many of those are summer opportunities and experiences, and you'll kind of have them booked up once you get here. So definitely take a break, take a deep breath, relax. If you have people in your orbit that might let you shadow or do an informational interview, that's a pretty low key, low commitment thing that you can do to get started. Research is one of those things that people can come in pretty revved up about. And there will definitely be first years doing research. And what I don't want to normalize is that everybody needs to be doing research when they get started. I've worked with students over the years that are, reading the cell and molecular biology book to try to understand what they're doing in their research lab. And it's so miserable and stressful because they just don't have the academic background to understand what's going on. But after they take Bio 201, research becomes like less of a challenge where they're always having to catch up, but now they've got a framework and a background. So everybody's a little bit different in terms of their academic background, their research background. We will have BAS connections teams that will do intake, if not in your first semester, definitely for the second semester. And there's courses related to that. So you can get academic credit for doing that research work. We have ways to use your work study to get paid to do research. There's a lot of things. We have an undergraduate research support office. So that might be something that you look up, you look at their advice about getting started with research. Once you're committed to Duke, you can sign up for their listserv, and they've got something for everybody at every stage of research. Once they're here, they do such a lovely job of supporting research in all the ways you can do it. So while some of you will come on and do research, most of you will not do it in your first semester or even your first year, and that'll be okay. You'll be doing service. You'll be, hanging out with your friends and building that community. There's plenty of ways to get started at Duke, and research isn't the only one.
With that being said, I think we are pretty close to time. So I want to just give a minute and a half to both of you. Any closing words you guys want to say?
Duke's a pretty amazing place. Don't be focused on what comes after it and forget to stop and smell the roses and thrive and get the best out of it. If you're intentional about how you approach it, you'll be ready for what comes afterward.
I would just kind of echo that and say one of my, actually, not one, my favorite thing about working at Duke is all of you and the students and getting to see the different paths you take and the journeys you take and the things that are important to you. And we hope that you're spending time while you're at Duke doing those things, becoming who you want to become. We'll help you at the end figure out how to get in if that's the goal, but really just getting to expose yourself to new things and learn and grow. And that's the part that's the most fun for us to listen and help you think through together.
Well, thank you both for your time. That was a whole hour that you guys gave in the middle of an evening when it's a pretty busy season here out in Durham. So thank you for your time. Thank you to all the panelists for coming on and having great questions. But I think that is good enough for us to close out.
Thanks for coming,
Yeah,
everybody.
thanks everyone for being here, and we hope to see you around campus in the fall.